Hey everybody, welcome back to The Whole Truth. I'm Dr. Wendy and I'm here again with part 2 of my Stonegate Chronicles with my good friend Dr. Andy Ruiz, who is a pharmacist, the president and co-owner of Stonegate Pharmacy, which has branches in San Antonio and Austin. And Andy is amazing because we're gonna talk about something fascinating today. And it gets to this new field that they're talking about called personalized or customized medicine. And what it involves is looking at individual people, patients, genetics, right? Because everybody always thinks that I'm a slave to my genetics, I'm doomed to my genetics. But what does that really mean? You know a little bit about your family history, but did you know that you can actually have your genetics analyzed very simply and relatively inexpensively through using some of the typing things
like 23andMe or Ancestry.com. They give you or Heritage, not to kind of advertise for anybody, but they give you the raw data so that using that raw data, we can upload it into particular platforms that are just easier to identify these SNPs or single nucleotide polymorphisms that everybody has. So it's really interesting because, like Dr. Askew was saying, it has such a massive impact on our body everywhere. So how do we identify what's actually bad and what is actually just normal? Because it's not uncommon to have these minor genetic differences throughout the body.
Tiny changes, little errors that occurred that affect how your body processes toxins, remove wastes, produces neurotransmitters. So when you do your genetic testing kit, they'll send you in your information what your background is, how much percentage you are, different ethnicities represented. Right. But what they don't give you up front is the rest of the picture, the rest of the story. Right. And Andy was mentioning that you can get that information sent to you, and Andy is able to take that information, download it, and then interpret a variety of genetic changes, and they would say mutations, that you may or may not possess. So for example, like my father died of a heart attack when he had just turned 49, and when the autopsy and everything was conducted, they found that all of his 5 coronary arteries were between 100% and 99% scarred. And this is a man who had been in pretty good health. He jogged, you know, he didn't take a lot of vitamins and whatnot, but he functioned up until the end, and he'd seen doctors who missed all of these things. But come to find out that I am a non-methylator, and I'm sure that contributed.
You nailed it, because it's so complex, and it's simple yet complex in the sense that we get this information, and for instance, like what Dr. Askew is saying is being a methylator is, do we turn these simple things such as B vitamins into the active forms and their methylated forms so the body can utilize them? And
what does our body utilize them for?
So it's interesting because let's use the B vitamins, for example, to breaking down hormones, right? So in other instances, to donate a methyl group to whatever they're breaking down so they can excrete it from the body. So overall, this is adding to that web of overall health and well-being of identifying, okay, am I a methylator? What else am I not metabolizing appropriately? Or am I metabolizing my dopamine too quickly in my brain, which is in turn causing symptomatology associated with ADHD, right?
Depression, lack
of
concentration, or the opposite, like over anxiety, like you said, ADHD.
Exactly.
And all of those things are caused by how our body produces neurotransmitters. And if we have defects in the production of those neurotransmitters, then you are going to be prone to developing that. It is not to say that because someone has one of these genetic defects that they will manifest the condition, but that if they have the condition, those genetic SNPs, changes, defects, should be tested for.
Absolutely.
So that you can treat it maybe in a more holistic way
than
with a lot of prescription medications that may have some side effects.
And it's how they all build up too, because it may be that, okay, I don't metabolize my B vitamins, which I don't as effectively, or I may not have the certain SNP to add methyl groups, such as if people like Brussels sprouts or beets, those are rich in certain B vitamins and certain nutrients such as betaine or manganese or copper that are cofactors in this whole metabolic pathway. So some people have difficulty losing weight or they have a lot of hair loss. It
lot
may
of
come
people.
off as like, I have thyroid symptoms. It may be as simple as I'm not metabolizing these things out of my body, and by taking the proper nutrients in, which is, let's get real, can be very hard to eat a bushel of Brussels sprouts or a bushel of beets or what have you. It's just not practical. So when you address these things from a genetic perspective, in which in pharmacy we used to call it we call it pharmacogenomics, but the reality is it's much bigger than just how the genes interact with medications, but it's how the genes interact with our body and our nutrients, our supplements, exactly our environment.
Yep.
So is it healthy for us? Absolutely. But it's identifying that personalized approach to the supplementation and overall health.
So let me ask you a question, like in the simple patient terms. If someone comes to me and they have all the thyroid symptoms, and I test them, say I even test them beyond just a regular basic thyroid function, but like I check for TSH, the free T3, the total T4, reverse T3, and say all of my numbers that I get back are normal, I'm at a point where I kind of am stuck and just tell patients like, I'm sorry, everything looks normal, I know you have these symptoms. Would it be reasonable that they might have a genetic problem that could be affected or improved, and those symptoms helped by recognizing the SNP?
Absolutely. So, and in some cases, it may be an underlying thyroid condition that is just not detected from our traditional labs. Because in some cases, in thyroid, it may be converting over from one thyroid hormone to the other. That's appropriate, but what we're not seeing is some of it's being shunted over to an inactive, more potent thyroid, which we call reverse T3.
Yep.
And binding up in those sites, and it masks the overall big picture.
Yep.
So having that genetic data really does enlighten us on what things that we need to be looking for.
I was just going to throw in, this is a little bit of an esoteric point, but in addition to maybe you do have the proper thyroid hormone complement, maybe the receptor site on the cell to receive those hormones isn't functioning, and that's something that knowing what your SNPs are.
That's brilliant, because even for people that have difficulties with relationships, or we see this in autism, where low oxytocin receptors. And like you're saying, it's not so much that they're not producing enough oxytocin, but maybe their receptors aren't expressed normally. So if they're not having the proper receptor density or availability for the body to actually take that message in via that oxytocin, in this example, we will not have that outcome that is looking for. So empathy or overall just awareness and cognition that is associated with things that are simple as oxytocin.
That you could fix so easily with a nasal spray.
Right, exactly.
And the problem is that most doctors, we don't have the ability to test for receptor status.
Exactly.
And so knowing these SNPs might be the key to really helping someone who's suffering with a medical condition when medicine we have failed them. So I love this. And when Andy analyzed my SNPs, he was able to compound a specific amount of, a little plug for Stonegate, a specific group of vitamins that absolutely addresses what my genetic defects, not all of them, but some of them, are potentially causing me harm. And so these vitamins really do help me feel a lot better.
And it's crazy because it's as simple as, and one of the things I like to ask people is like, do you like beets? And I never ate beets growing up, so more and more people are like, oh, yeah, I feel great when I eat beets. And that's just a quick insight to like, okay, you're lacking or possibly lacking betaine or zinc or some of these other nutrients. And from that perspective, you start realizing food does change your body, and it doesn't, it's not as simple as taking a medication, but it is a whole lifestyle change. That these targeted, personalized supplementations really do give you more of a advantage, more of that point towards accepting of, okay, this is what I want to do in my life, to just take a hold of it and grab the bull by the horns, for lack of better words.
Redirect your health in the right direction. And what I think is really important to say is that we do tend to feel like we're just doomed to what our genes dictate in our body. But the whole field of epigenetics and epigenomics and nutrigenomics is all about recognizing and understanding that 75% of our genes are modifiable by our environment and our lifestyle. So, and unfortunately, I'm the first one to admit it. Like, I have a busy life. I tend to eat pretty badly. I love vegetables, but I can't eat vegetables while I'm driving and talking on the phone at the same time. Not that I would ever do that, but I think supplementation is probably necessary for most people. And it's a reflection of one, a fast-paced lifestyle, busyness, poor food choices that we make, but also, this is just a little like fringe comment that I'll make, is that our food supply isn't very good anymore. We've over-farmed the soils, we've dumped tons of pesticides and fungicides and things into our farming areas, and so our food, this is just recognized, our vegetables have less nutrition than they did 30 years ago, and also the genetically modified products are specifically engineered to receive certain pesticides and respond to them, and that can negatively impact our body's ability to absorb nutrients, incorporate those nutrients into our cells, and for the cells to function properly. So that was really convoluted, but my personal belief is that unless you're a teenager, it's very hard for your body to handle all the challenges and insults as we get older without taking some supplementation.
You nailed it, because it becomes more and more evident as we age.
Yep.
And back to that topic of aging gracefully, the hormones, the supplementation, the health, the
sleep,
well-being.
the yoga,
and
the
it's nice
meditation.
to catch it in us, because as we have children, we can foresee it in our own offspring that we can correct in advance. So it's something to really take serious and grab a hold of, so this way we can fend off later health conditions that might rear its head, like depression, like high blood pressure. I mean, we can go on and on about the things that it can help.
Heart disease, early cardiac
mitigate.
death.
Yeah, it may not get rid of it, but it could limit the negative impact of these things.
Absolutely. And I think it is helpful, because there are things, and I think this would test too, like the ApoE4 allele and stuff. There are genes that predispose us to higher rates of things like Alzheimer's, cardiac disease, and these things can be tested for, and there are things you can do to decrease your risks of developing these conditions. I think also there are things to tell what antidepressant may not work for me.
Absolutely.
What blood pressure medicine might be best for someone opposed to somebody else.
Exactly, and so that's the other thing that's beautiful about this. This is where pharmacogenomics came into play, is how am I going to respond to certain non-steroidal anti-inflammatories, certain warfarin or blood thinners that may be required as we age, or overall antidepressants, like you mentioned. So what is the right medication for us? And sometimes we're taking blood pressure medications, such as I used to take at one point, that I found out it wasn't having an impact on me because my body was predisposed to not responding to it. So it's complex, but overall it's the future.
And it's important.
Exactly.
Sometimes, just like you said with the blood pressure medication, not that I manage blood pressure very often, but sometimes you'll see someone who's on 3 different blood pressure medicines, and you just have to wonder, like, they've been put on one agent, maxed it out, higher and higher doses, and it never really responded, so they added another one, and then started elevating that one, when just the simple process of analyzing
identifying
someone's
which one.
SNP, you may be able to just start with the right medication, keep the dose low, and optimize their health.
And it's little things that people can look out for to see if it's something might be going on. So I've always known I've been, this is a kind of a gross thing to admit, but a sweater. I sweat, significantly.
Yeah.
However, after going through this extensive genetic testing, identifying what was best for me, it blows everybody away, but because they're like, well, you're not a hot mess anymore.
What happened?
I mean, just simple little things of the supplements that have, dried me out, I guess, if you will.
Look at that.
But
who knew?
It's a better quality of life, a better lifestyle, so I'm not worried about scratching my head and am I sweating. But it's little things that improve your overall outlook on life. Not just how you feel good, but also being healthy inside. Right.
I love it. So all this personalized information and customized medicine is the wave of the future, as Andy was saying, and it's all available. I think you can get those genetic tests done now for like 70, 80 bucks.
Exactly. Sometimes 50 bucks.
Yeah, when you get a Groupon for them. But this is important information. We hope it helps some of you. I want to thank you all for joining us.
Yes.
Please check us out every Wednesday night at 8:30. Thank you so much for tuning in. Thank you,
guys.
Andy.
Thank you for having me.
Appreciate it.
Appreciate it.